Welcome to The Explainer. Today, we're going to crack open the medical toolkit and take a close look at the go-to meds for three of the biggest complaints out there: pain, spasms, and inflammation. We'll get into their power, sure, but also their risks, and really zero in on the #1 priority for each one: to keep patients safe. So imagine your patient is hurting. What do you reach for? We're going to break down the main classes of these drugs, from the heavy hitters all the way to the everyday stuff, so we can really understand not just how they work, but more importantly, what we need to watch out for. And we have to start with the heavy hitters, opioids. Look, these things are incredibly good at what they do, which is stopping severe pain. But as we're about to see, that kind of power comes with some pretty serious risks that every single healthcare provider has to know how to manage. So how do they work their magic? Well, you can think of opioid agonists as a special key. They fit perfectly into these little locks, the opioid receptors in our brain and spinal cord. And when they turn that key, they basically tell the brain to turn the volume way, way down on pain. They're the go-to for really intense stuff, like after surgery or for cancer pain. Now, let's take morphine. What's absolutely fascinating here is that its greatest strength is directly tied to its greatest danger. It's fantastic at quieting those pain signals, but it can also quiet the body's most basic instinct, the drive to breathe. And that's why the absolute #1 priority is keeping a close eye on that respiratory rate, always. And you better have the antidote ready to go. So this leads to a scenario you have to be ready for. Your patient's breathing drops. It's getting dangerously slow. What's the emergency stop button? What is that immediate countermeasure you need to deploy? And the answer is an opioid antagonist. The best way to think of this is like a bouncer for those opioid receptors. It comes in, kicks the opioid out, and then stands in the doorway, blocking it from getting back in. This immediately reverses the opioid's effects and lets the body remember, oh yeah, I need to breathe. And naloxone, or Narcan, is the perfect example of this critical trade-off. Yes, it saves lives. It reverses that respiratory depression. But when you do that, you can throw the patient right back into extreme pain and immediate withdrawal. And here's the other crucial thing. Narcan wears off. The opioid might still be in their system long after the Narcan is gone, which means you might have to give another dose. Okay, let's shift gears now. We've talked about severe pain. But what about a related problem that can be just as debilitating? Let's talk about muscle spasms. Tackling these requires a whole different set of tools. Muscle relaxants, their job is pretty straightforward: to calm down those twitchy, overactive muscles. You see this a lot in conditions like MS or with spinal cord injuries. But they're not working on pain receptors like opioids. No, they're targeting the nerve signals that are making the muscles go haywire in the first place. So let's look at baclofen. The drowsiness and dizziness, yeah, you expect that. It means fall precautions are a no-brainer. But honestly, the most critical, most important warning is hiding right there at the end of that priority list. You absolutely, under no circumstances, stop this medication suddenly. And here's why that is so important. If you just stop baclofen cold turkey, it can cause some really scary things to happen. We're talking severe rebound spasms, hallucinations, even life-threatening seizures. The patient has to be tapered off nice and slow under close supervision. Now, with another muscle relaxant, dantrolene, our focus completely shifts. We're not worried about withdrawal here. Now, we're worried about a specific organ, the liver. Because this drug can cause liver toxicity, monitoring those liver function tests isn't just a good idea, it is absolutely essential. And then there's cyclobenzaprine. You see this one all the time for acute back spasms. The big thing to watch for here are what we call anticholinergic effects. Basically, it dries you out and can make you drowsy and confused. And you have to be especially careful with this in elderly patients because they're way more sensitive to these side effects. All right, we've covered the big guns, but what about all those common aches and pains? Let's switch over to the medications that millions of people reach for every single day to deal with everything from a headache to arthritis. And this is where the workhorses of pain relief come in. NSAIDs, that's non-steroidal anti-inflammatory drugs. Their real power is that they are a triple threat. They fight pain, they fight inflammation, and they fight fever, all at the same time. But of course, that powerful action comes at a price. NSAIDs can be really tough on the stomach lining, leading to irritation and even bleeding. Plus, they can put a strain on the kidneys. So the key takeaway here is super simple. Always take them with food and keep an eye out for any signs of stomach or kidney trouble. Now, this next point is huge.
It is so important to know the difference between NSAIDs and acetaminophen. Yes, Tylenol is fantastic for pain and fever, but it does not have any anti-inflammatory effects. So if the problem is swelling, acetaminophen is the wrong tool for the job.
And with this one, the big flashing red light isn't the stomach or the kidneys, it's the liver. Acetaminophen is totally safe when you use it correctly, but going over that 4,000 milligram daily max can cause severe, sometimes irreversible liver damage. That dose limit is the absolute #1 thing you have to teach your patients. Okay, to finish up our tour of the toolkit, let's look at a few specialists. These are the drugs designed for very specific problems, from migraines and allergies to just overwhelming inflammation. Sumatriptan can be a total game changer for someone in the middle of a migraine. It works by constricting or narrowing blood vessels in the brain. Now, that's great for the headache, but that same mechanism means it's definitely not for everybody. You have to do a really thorough cardiac history because it can be dangerous for anyone with heart disease or high blood pressure. I love this comparison because it shows you how medicine evolves. You've got the old school antihistamines, like diphenhydramine, which work great for allergies but can totally knock you out. And then you have the newer options, like loratadine, that give you all that allergy relief without making you super drowsy, which makes them way better for using during the day. And for that really severe, out-of-control inflammation, we bring out the heavy artillery, glucocorticoids like prednisone. They are incredibly powerful, but you have to remember 3 key things. 1, they can crank up blood sugar. 2, they suppress the immune system, so infection risk goes up. And 3, just like baclofen, you must never, ever stop them abruptly. So we've looked at all these different drugs: opioids, muscle relaxants, NSAIDs. What's the one common thread that ties them all together? It's the person who's giving the medication. In the end, it all comes down to these golden rules. It doesn't matter if you're giving morphine or ibuprofen. Your assessment, your patient education, and just being aware of the risks, that's what makes these powerful chemicals safe and effective. You are the final, most important safety check. And that leaves us with one last big idea. You know, it's one thing to just memorize a list of side effects, but it's a completely different thing to understand why they happen. Understanding the why behind the warning, well, that's the foundation of smart, proactive, and truly compassionate patient care.